So how does Keytruda work in prostate cancer patients?
Well, there's a technical answer, and then there's probably a more common sense answer, and that is that it just enhances the immune system globally to be more reactive and active against cancer. And our immune system's always working on our behalf to fight the cancer, and so the Keytruda strengthens that fight and improves the efficacy of the immune system.
I mean, you mentioned the side effects, but in combination with everything else, the side effects of Keytruda over time, you've just seen that it's pretty short-lived, and once you're on the drug, those are the side effects, or does it have any permanent side effects?
It can have permanent side effects. One of the things about the immune system, one of the good things, is that when you implement immune therapy, the impact on the immune system, or the immune system has a memory. And so it will keep going even after the treatment is stopped. And that's true for side effects too, that if men develop side effects from immune therapy, that they can be ongoing after the treatment is stopped.
And is there any way to mitigate those, or is it just kind of something that they need to watch for?
Well, I'll tell you, Keytruda is complex because there's so many. You can get thyroid problems, adrenal problems, and so people need to be monitored closely. And the first step, of course, is to cut back on the dose or stop the medicine. The second step is to use some cortisone to try and calm the immune system down. And it's pretty custom in how people react to these medicines.
I know a question that we get in our comments is people are wondering how effective Provenge versus Keytruda versus Olaparib are. And so can you explain, I know there's differences of when it'll work in a certain type of, with certain sets of genetics.
Well, I think, both Provenge and Olaparib are FDA approved to treat prostate cancer. So if you look at the efficacy of Olaparib versus Provenge, they're probably similar. Both of them work better when you get after the treatment at an earlier stage rather than waiting until the cancer becomes very advanced. The efficacy of Keytruda has not been proven yet. There's a phase 3 trial ongoing, and how much of an impact that will have on survival is as of yet unknown.
In your practice, obviously, you've treated men with Keytruda, so have you seen some really amazing miracle cases, or has it just been in combination with all the other treatments?
Well, it's effective. We published a clinical trial showing that about half of the men with prostate cancer that underwent treatment with Keytruda, sometimes in combination with other things, would develop PSA stabilization or a PSA decline with the therapy. So it's a useful drug. It was clearly shown in the studies that we did that the men who had lower PSAs and lower volume cancers did better than the ones that had really advanced cancers.
So is Keytruda an injection, a pill?
So Keytruda is an injection, an infusion given every 3 weeks. As we mentioned, Provenge is also an infusion. It's given every 2 weeks for a total of only 3 doses. And then the Xtandi, as we all know, is a pill.
So how does a man have access to Keytruda since it's not FDA approved currently?
Well, Merck Pharmaceuticals has been very generous. They have a very easily accessible compassionate use protocol. So the medical oncologist merely has to request it and provide some background information, and the medicine is provided free of charge from Merck.
So can any medical oncologist get access to Keytruda through Merck?
As far as I know, the access has been quite easy, and there have been very few stipulations. And we have had patients in other states seen by other oncologists who've requested the same program and access the medicine with little difficulty.
You mentioned that patients can get access to Keytruda through compassionate care use. So does that mean that the company is giving the drug to the patient? Do they have any cost involved with that?
The drug is free. So the drug is provided to the oncologist, who then is able to pass it on free of charge to the patients.
Thank you for watching. If you would like more information about anything that we spoke about today, you can visit our website, PCRI.org. Also, please subscribe to our YouTube channel. We come out with new prostate cancer videos every week.